Welcome back to Island Life Live. BrightStar Care of Honolulu was founded nearly 15 years ago on the belief that the best care always goes the extra mile, and his team helps to ensure a smooth transition from hospital or rehab to home for our precious kupuna. And joining me now are Star Care of BrightStar of Honolulu owner Alison Lee. How's it?
Hello.
How are you?
Great. How are you?
And Rachelle Cabrillas. She's an RN, BSN, Director of Nursing, and thank you guys so much for joining us. And you actually rose to the ranks with
Yes.
BrightStar Care of Honolulu, yeah?
Yes, I did start with them many years when they first opened as a caregiver, and then I went to school and I came back.
Wow. And now you're running things over there. That's awesome. All right. First of all, mahalo for caring for our kupuna. I know it's an important job, incredibly important kuleana. Can you share some of the common reasons kupuna are admitted into the hospital?
Well, infections such as UTIs, falls, very common reasons that a lot of times they'll end up getting admitted and
Yeah.
need to recover.
So I know infections, even pneumonia, things of that nature, right? And
Yes.
I know nowadays we got a lot of those respiratory illnesses, COVID, and, RSV. So yeah, so okay, that's some of the comments. Now, what are some of the potential impacts it has on the lives of the patient and also their loved ones?
Well, definitely it can cause a decline, and it can cause big shift in they were at home, they were independent, they go into the facility, they recover a bit, but then they're not quite at their old baseline that they used to be. But they want to stay at home, and then we can help them do that. We can help them stay on the plan they were discharged with to help them recover. We can help them, do some of that personal care that they're starting to have a hard time with to keep them from, reduce these infections, keep them from falling, keep them there, aging in place.
I love that, and it with a sense of dignity as well, because once you lose that independence, it can also affect you mentally, yeah, Alison?
Yeah, absolutely. And I think speaking of the effects when these falls and hospitalizations happen, Rachel's speaking a lot to the clinician and the care side of things, but just how it affects the patient and the family is so dramatic. Also, it's this often very sudden. A lot of times we see kupuna who are very independent and they'll have a fall or they'll have an infection, they go to the hospital and everything changes, and it's incredibly stressful for the families. It's incredibly stressful for the patient themselves. So really navigating that and trying to just pull yourself together and start thinking through what are the next steps that we need to take.
Yeah, that is absolutely important, because especially the planning and the coordination with not just the medical team and those experts, but also the family at home. How can you kind of walk us through that? How important that is, and what should we be doing?
Well, definitely always sitting down and figuring out not just what your loved one needs, but what you need too to take care of yourself, to help take care of them. And then we're there to support that. We want to make sure the family has respite so they can go out, get errands done, do essential things, take care of themselves, and also be able to take care of their loved ones too. We're part of that process of, what can we do to keep them as independent as possible in the home? Would just a little extra rail right here help, help them, get up without the risk of falling, help the family member from straining, of improperly lifting. There's, many things we want to help make the best setup, for them to be as independent as possible, but also provide that support and companionship, for them, and, let the family know we're there for them.
Absolutely, it's super important. I mean, my family is going through that right now, so, and it becomes taxing on everybody in the family. So that we just heard Savi Makalena talk about this, that the caregiver also needs care. So absolutely, the planning and coordination, very vital. Now, what are some of the considerations our viewers should keep in mind if they're looking for in-home care? Real quickly, we got about 30 seconds.
Just, sorting through, sitting down, most of all with your loved one, what do they want? Have that real conversation of what do you want? They might be resistant to care, but you might need to just level them, what do you need? What do you want? Also, this is what I need and what we need for the grandchildren too. And, also taking a look back at, do they have any care policies or anything that could help support this too? and cover these type of services.
I love that. Absolutely. Communication is key with the patient and also the family members and with the team. Thank you guys so much. Alison and Rachel of Star Care of Honolulu, we appreciate everything you do for our kupuna.
Thank you for having us.